Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about ABG interpretation using tic-tac and toe method. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notification. Let's get into this session. To start with, let's discuss the ABG normal values first. First comes the pH. Normal value of pH is between 7.35 to 7.45. If it falls below 7.35, then we say it is in the acidic state. And if it goes above 7.45, we say it is in the base state, also known as alkalotic state. Next is PaCO2, partial pressure of carbon dioxide. The normal value here is 35 to 45 mmHg. For a better understanding, using this tic-tac-toe method, we have changed it to 45 to 35 mmHg, and when it falls above 45 mmHg, we say it is in the acidic state, and if it is below 35 mmHg, we say it is in the alkalotic state. Next comes bicarbonate. The normal value is between 22 to 26 milliequivalent per liter. When it goes below 22, we say it is in the acidic state, and when it goes above 26, we say it is in the alkalotic state. When we notice all these values come under acidic state together or alkalotic state together. For this reason, the value of PaCO2 has been interchanged. For further understanding, remember partial pressure of carbon dioxide is an acid, whereas bicarbonate is a base. Before beginning the examples, if there is primary change in PaCO2 value, we say it is a respiratory problem, and when there is a primary change in the bicarbonate value, we say it is a metabolic problem. Let's begin the examples. First example, the pH is 7.20. PaCO2 is 50 mmHg and bicarbonate is 25 milliequivalent per liter. Let's get into the tic-tac-toe method. If we see the value of pH, it is 7.20, which falls below 7.35, that is normal value, and hence it is in the acidic state. PaCO2 is 50 mmHg, which is more than 45, and it is also in the acidic state. When we see bicarbonate, it is 25 milliequivalent per liter, which falls in the normal state. And when we see all these values, pH and PaCO2 falls in the acid state, which explains it is a respiratory acidosis. Looking further into the example, let's discuss if it is an uncompensated or compensated or partially compensated respiratory acidosis. Let's discuss what is uncompensated first. When there is no attempt to correct the acid-base imbalance, we refer it as uncompensated. And looking back into the first example, value of bicarbonate falls in the normal state, which has not undergone any change to correct the imbalance, and hence we say it is an uncompensated respiratory acidosis. Let's get into the second example. Value of pH is 7.30, value of PaCO2 is 40 mmHg and bicarbonate is 20 milliequivalent per liter. Beginning with tic-tac-toe method, value of pH falls below the normal range, which says it is in the acid state. Value of PaCO2 is 40 mmHg, which falls in the normal state. Bicarbonate is 20 milliequivalent per liter, which falls in the acidic state. And using tic-tac-toe method, we conclude that it is a metabolic acidosis. Let's identify the degree of compensation. When we look into the PaCO2 value, it falls in the normal state, and hence we can say this as uncompensated metabolic acidosis or metabolic acidosis uncompensated. Here, PaCO2 has not undergone any change to correct the imbalance. Let's look into one more example. pH is 7.50, PaCO2 30 mmHg, bicarbonate 25 milliequivalent per liter. When you look into the pH 7.50, it's more than the normal value, and hence it is in the alkalotic state. PaCO2 is 30 mmHg, which also falls in the alkalotic state. Bicarbonate is 25 milliequivalent per liter, which falls in the normal state. Because pH and PaCO2 matches in the alkalotic state, we say it is a respiratory alkalosis. Now, to identify the degree of compensation, when we see bicarbonate value, it is within the normal range and it has not undergone any change to correct the imbalance, and hence we say this as an uncompensated respiratory alkalosis. Let's look into the other example. pH is 7.50, PaCO2 is 38 mmHg, bicarbonate is 30 milliequivalent per liter. pH is 7.50, which falls in the alkalotic state. PaCO2 is 38 mmHg, which lies within the normal range and hence it falls in the normal state. Bicarbonate is 30 milliequivalent per liter, which falls in the alkalotic state. Using tic-tac-toe method, pH and bicarbonate matches in the alkalotic state and hence we say it is a metabolic alkalosis. To look into the degree of compensation, when we see the value of PaCO2, it is 38 mmHg, which is in normal state and it has not undergone any change to correct the imbalance and hence we say it is an uncompensated metabolic alkalosis. Now comes partially compensated. When body is trying to correct the imbalance, that is secondary response by increasing or decreasing either PaCO2 or bicarbonate value, we say it is a partially compensated change. Here pH is abnormal. Let's begin with the example. First one, pH is 7.20, PaCO2 is 50 mmHg and bicarbonate is 30 milliequivalent per liter. Using tic-tac-toe method, pH is 7.20, which falls in the acidic state. PaCO2 is 50 mmHg, which also falls in the acidic state. Bicarbonate is 30 milliequivalent, which is more than the normal range and hence it falls in the alkalotic state. Because pH and PaCO2 matches in the acidic state, we say it is a respiratory acidosis. Now let's identify the degree of compensation. When we look into the bicarbonate value, it has increased to correct the imbalance and therefore we say it is a partially compensated respiratory acidosis. Looking into the next example, pH is 7.30, PaCO2 is 32 mmHg, bicarbonate is 20 milliequivalent per liter. Using tic-tac-toe method, pH falls in the acidic state. PaCO2 is 32 mmHg, which falls in the alkalotic state. Bicarbonate is 20 milliequivalent per liter, which falls in the acidic state. Because pH and bicarbonate matches in the acidic state, we say it is a metabolic acidosis. Now let's identify the degree of compensation. Here, PaCO2 has decreased in order to correct the imbalance and hence we say it is a partially compensated metabolic acidosis. Let's get into the other example. pH is 7.50, PaCO2 is 30 mmHg, bicarbonate is 21 milliequivalent per liter. Using tic-tac-toe method, pH is 7.50, which falls in the alkalotic state. PaCO2 is 30 mmHg, which is less than the normal range and falls in the alkalotic state. Bicarbonate is 21 milliequivalent per liter, which is also less than the normal range and falls in the acid state. Here, pH and bicarbonate matches in the alkalotic state and hence we say it is a respiratory alkalosis. To identify the degree of compensation, when we look into the value of bicarbonate, it has decreased in order to correct the imbalance and hence we say it is a partially compensated respiratory alkalosis. Next example. pH is 7.50, PaCO2 is 48 mmHg, bicarbonate is 30 milliequivalent per liter. Using tic-tac-toe method, pH is 7.50, which falls in the alkalotic state. PaCO2 is 48 mmHg, which falls in the acidic state. Bicarbonate is 30 milliequivalent per liter, which falls in the alkalotic state. When we see pH and bicarbonate matches in the alkalotic state and hence we say it is a metabolic alkalosis. To look into the degree of compensation here, PaCO2 has increased its value in order to correct the imbalance and therefore we say it is a partially compensated metabolic alkalosis. Now let's discuss a fully compensated change. That is, The body is correcting the imbalance, here secondary response, by increasing or decreasing PaCO2 and bicarbonate values. Here the pH remains in the normal range. Let's get into the example. pH is 7.35, PaCO2 is 48 mmHg and bicarbonate is 28 milliequivalent per liter. Using tic-tac-toe method, pH is 7.35, which is in the normal state, but still it is in the acidic state. PaCO2 is 48 mmHg, which falls in the acidic state. Bicarbonate is 28 milliequivalent per liter, which falls in the alkalotic state. Here, pH is still in the acidic state and PaCO2 is also in the acidic state, and hence we say it is a respiratory acidosis. To identify the degree of compensation, when we look into the value of bicarbonate, it has increased and corrected the value of pH to normal range, and hence we say it is a fully compensated respiratory acidosis. Next example, pH is 7.45, PaCO2 is 30 mmHg and bicarbonate is 21 milliequivalent per liter. Using tic-tac-toe method, pH falls in the normal state, but still it is in the alkalotic state. PaCO2 is 30 mmHg, which falls in the alkalotic state, and bicarbonate is 21 milliequivalent per liter, which falls in the acidic state. Here, pH and PaCO2 matches in the alkalotic state, and hence we say it is a respiratory alkalosis. To identify the degree of compensation, the value of bicarbonate is 21, which has decreased in order to correct the pH value to normal range. Therefore, we say it is a fully compensated respiratory alkalosis. Now, let's discuss what is mixed acidosis and mixed alkalosis. Mixed acidosis means respiratory and metabolic acidosis combined together, and mixed alkalosis means respiratory and metabolic alkalosis combined together. Let's discuss with some of the examples. First example, pH is 7.55, PaCO2 is 30 mmHg and bicarbonate is 29 milliequivalent per liter. Using tic-tac-toe method, pH is 7.55, which is in the alkalotic state. PaCO2 is 30 mmHg, which is also in the alkalotic state. Bicarbonate is 29 milliequivalent, which is more than the normal range and falls in the alkalotic state. Here, pH, PaCO2 and bicarbonate all gets matched in the alkalotic state, and therefore we say it is a mixed alkalosis, that is respiratory and metabolic alkalosis combined together. Next example, pH is 7.30, PaCO2 is 50 mmHg, bicarbonate is 20 milliequivalent per liter. Using tic-tac-toe method, pH falls in the acid state. PaCO2 is 50, which also falls in the acid state. Bicarbonate is 20 milliequivalent per liter, which falls in the acid state. To look into this, pH, PaCO2 and bicarbonate gets matched in the acidic state, and hence we say it is a mixed acidosis. Now, let's practice some of the examples. Here, you will be given 5 seconds to rule out the answers. Let's get into the first example. pH is 7.29, PaCO2 is 54 mmHg and bicarbonate is 31 milliequivalent per liter. Using tic-tac-toe method, let's get the answers. And the answer is respiratory acidosis partially compensated. Let's get into the other example. pH is 7.48, PaCO2 is 40 mmHg, bicarbonate is 31 milliequivalent per liter. And we get the answer. Metabolic alkalosis uncompensated. Next example is pH is 7.28, PaCO2 is 32 mmHg, bicarbonate is 18 milliequivalent per liter. And the answer will be metabolic acidosis partially compensated. Here you go with the ABG interpretation using tic-tac-toe method. If you find this video useful, please like it and please subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.